Hello everyone, this is part 2 of my series, Newborn Hospital Exam. And today we're going to be discussing what your pediatrician examines with hands, feet, and arms. There's several conditions. Number 1, first and foremost, 10 fingers, 10 toes. That's pretty simple, everybody wants that. However, there's a condition called polydactyly. It's very common. It happens in 1 in 1,000 births. And that's where there's an extra finger or an extra toe, typically on the side of the pinky. So most of the time it's skin, can be skin, nerves, and bones. And what we need to do is we need to get an x-ray to see the extent of it, and surgery needs to be done to remove it. It used to be that if it was just a little nubbin, that they used to just tie it down and then it would fall off. However, they did find that there were still nerves underneath. So that caused pain, and little kids aren't necessarily going to be talking about pain, especially if they were born with this, and it shows up later in life. So what causes polydactyly? It's actually multifactorial. It can be genetic, but it can also be environmental. So typically things like smoking, alcohol, and also drugs can cause it. Syndactyly is when 2 or more fingers are joined or there's webbing in between. It's also common. It occurs in about 1 to 2,000 to 3,000 births. So not as common as polydactyly. The causes of it are also genetic, and in this situation, we do recommend genetic testing. Treatment also includes getting an x-ray and having surgery done to fix the problem. Next, we're going to be talking about macrodactyly, and that's the condition where a child has a digit, again, a finger or toe, and sometimes it's more than just 1 finger or toe, that is actually overgrown. There's overgrowth of the skin tissue around it, and there's overgrowth of the bones as well. So the causes for this are typically genetic. There can be environmental factors as well, but most of the time we do recommend genetic testing because other conditions such as tuberous sclerosis or neurofibromatosis can be found in a child that has an overgrowth of 1 finger or toe. The treatment involves an x-ray, potentially surgery. This is most important to have close monitoring. If that finger remains stable and doesn't really continue to grow like all the other fingers grow, or doesn't outgrow as the other fingers are growing, then surgery is not going to be required. Sometimes the bone surgery is required, sometimes it's just the overgrowth of the skin tissue that's required, but it is really a case-by-case basis. So the other thing we look at is how many palmar creases does your baby have? So typically we'll have 2 horizontal lines on the palm of our hand, and that's very typical. But it doesn't happen for everybody. This is actually pretty common. 1 in 30 births actually have a single crease. Now this can be nothing and just very normal and no worries about anything. However, it's also very commonly found in Down syndrome and fetal alcohol syndrome. So depending upon what's going on with your child, further testing may be required. However, the most important thing in this situation is going to be observation and a good medical history. What's going on with the family medical history? We do need to find out, and usually this is done very privately, to find out how much drinking has the mother been doing during pregnancy, and even the prior births. Because with fetal alcohol syndrome, for example, if we're drinkers, we tend to drink more. If you're an alcoholic, you tend to drink more. So each baby will progressively have a more pronounced case of fetal alcohol syndrome. So we will find out and ask questions about are there developmental delays, how are the children doing? And we will ask directly, and we'll ask privately, because sometimes this is a hidden disease, alcoholism, and anything we find out will be better to help out the baby. Next, we're going to talk about arms. The most common condition that will happen at birth is called Erb's palsy. Erb's palsy is very common. It actually happens in 1 to 3 of 1,000 births. And that's a situation where your baby's arm is very limp, and they can also have the hand turned backwards. So it's called a waiter's tip. What is Erb's palsy? We have what's called a brachial plexus in our shoulder that connects our neck to our shoulder. Sometimes there's different reasons that a baby frankly can't be delivered easily. Either it's a big baby, mothers that are diabetics that were uncontrolled tend to have bigger babies, for example. Sometimes genetically it's just a bigger baby. Another reason why Erb's palsy can occur is if the baby was breech. Sometimes it's just hard to deliver the baby. So usually you have to apply pressure, and obstetricians are very adept with how to do this so they don't injure the baby. But there are certain situations, there are even emergency situations, something called shoulder dystocia, where the baby actually gets stuck. And that's very serious because you can have the mother get affected and maybe even die, and even the baby as well. Again, that's not so common, and obstetricians are trained to know how to deal with this. But regardless, When you have a situation that the baby's just not coming out of the vaginal canal, the pressure needed to apply to get this baby out could cause an injury where that nerve plexus is overstretched. And when it's overstretched, it gets injured and then the arm just goes limp. So we're going to have close observation. Many times this just disappears within like the first 3 months. But it also depends how mild it is. So if it's a mild condition, usually don't have to do much. However, many times physical therapy or occupational therapy is recommended so that your baby can improve. Now, what if your baby isn't better by 6 months old and they still have the Erb's palsy and the effects from it? That's when we start talking about surgery, that might be required. The last thing we're going to be talking about today is missing or shortened bones in your arm. Typically, this can also happen in the legs as well, but we're talking about arms today. When there's a shortened bone on the side of the thumb, that's called a radial longitudinal deficiency. When there's a shortened bone on the side where your pinky is, that's called an ulnar longitudinal deficiency. This is going to require a lot more help because, again, your baby is growing. Those bones are going to be growing, those nerves are going to be growing, and you need a fully functional arm or as close to it as can be. So it is going to mean that x-rays are going to be done, surgeries will be done with time. These surgeries are not done right away, but you need to have a follow-up and continued follow-up with a surgeon. Diagnosis and treatment involves an x-ray and therapies. Your baby will need physical therapy and occupational therapy as they're growing, because as the bones are growing and the nerves are growing, they're probably going to be needing surgeries as well. And those therapies are going to help them along the way so that they can fully use their arm to the best extent that is possible. They can keep evaluating, reevaluating, and seeing other surgeries that are possible. Many people have a full life with this. It is cumbersome, it is a burden, it is a stress. But I want you to leave here thinking there is hope, there is help, and things can be done for it. Thank you once again for joining me, and I hope you found this very helpful. Please let me know what you liked about this. Let me know what other things you'd like me to discuss. The more I know, the better I can serve you. Please consider following the channel and follow me on social media. Until the next time, thank you. Bye-bye.